Hi, my name's Christine and I'm a student nurse and I'm going to talk to you about proper hand hygiene. So I'm going to use an alcohol-based hand sanitizer and I'm just going to show you the proper technique. So it's important to rub your hands for about 15 seconds, making sure that you get your fingernails, your knuckles, and all the different areas that we have a tendency to ignore. This is something that we would perform. There's the 4 points of hand hygiene. So that is before you go into someone's room, like from an external environment, once you're in the room, before you do a procedure, after contact with the patient, and as you leave the room. Now, usually you use hand sanitizer, but if your hands are soiled, that's when you would use that you would do hand washing with soap and water. Come on, let's go see my patient. Come with me as I see my next patient, Mrs. Helen Varga. Let's go. Hi, Mrs. Varga. How are you feeling today?
I'm fine, thank you. How about you?
Oh, I'm feeling pretty good. That's good to hear. So I'm wondering if you could just state your full name and your middle name and your birth date for me.
Helen Varga,
Okay, and your birth date?
March 31st, 1943.
Okay, great. All right. So I'm going to take your temperature. The reason taking someone's temperature is important is you're checking for their core temperature and the difference between the heat that they generate and the environment and the exchange thereof. This is important to indicate, like when there's different changes, like if somebody has a fever, if the temperature is really high, or someone's temperature is really low, it indicates that the body is not in balance. Okay, so somebody like Helen, is it okay if I call you Helen? Okay, great. So somebody like my patient here, she's a healthy 71-year-old female. Her average temperature would probably range between 37.6, no, I apologize, 35.8 to 37.6. Okay, I'm about to take her temperature, so I'm just going to wash my hands. And this is because I'm doing a procedure that involves her care. Okay, are you ready? So there's different ways that you can take someone's temperature. There is orally or under the axilla. There's tympanically, which is in the ear with a special type of thermometer. There's temporally with another special type of thermometer, and there is the strips as well that go in the forehead, which is often used in pediatrics. Now, Helen, which way would you prefer? What are you most comfortable with? Okay, great. Okay, if you don't mind, I'm just gonna. All right. We're just gonna keep it under here for a minute. All right. Are you comfortable? Okay.
I am.
That's great. So we'll just wait a minute until it beeps. Okay, great. Sorry about this. Okay, 36.5. Right within normal range. Okay, well, thanks a lot, Helen.
Thanks.
Okay, Helen, now we're going to be taking your pulse. There's several different ways that you can take someone's pulse. That would be temporally, at the carotid, brachially, medially, at the ulnar, um, at the femoral artery, which is in this area, at the apex of the heart. You would need a stethoscope for that. At the popliteal area behind the knee, and on the inside of the foot, and on the top of the foot. Okay, Helen, so we're going to take your pulse for about a minute, and we're going to take it at the medial area, the medial artery. Oops. Okay. And I'll be doing this for a minute. Just let me know if you're uncomfortable at any point. Okay, so the normal ranges for the pulse, and what we're looking for the pulse, the reason we're taking it is to assess for proper circulation. So the normal ranges would be between 60 to 120, and Helen's pulse was 60. I was also assessing her respirations, and so what I was doing for the second half of that minute was I was just looking at her breathing up and down. And her respiration rate, the normal rate, is between 12 and 20, and she was actually at 16. Okay, so next I'm going to listen to her chest and listen for breath sounds. So this is what you're doing. You're listening for any abnormalities. There's 3 normal breath sounds, but we're listening for adventitious sounds, and that would be like crackles, wheezing, and stridor. And I'm going to be doing that on certain areas on her chest and on her back. So she is able to stand up, so she's going to stand up and help me with this. Just let me know if you're ever uncomfortable, okay, Helen? Okay. Just breathe normally, okay? Sorry about this. Okay. Okay, don't mind turning around, thank you. Just take a deep breath. Take a deep breath. Another breath. One more breath in. Okay, we're finished. Is good? Yeah. No crackles or wheezes were heard. Thanks, Helen. Okay, Helen, now we're going to be taking your blood pressure. So the importance of blood pressure, it's the force exerted on the wall of the artery by the blood. So you're measuring things like cardiac output. You're actually looking for abnormalities like high blood pressure would indicate hypertension, and a low blood pressure would indicate hypotension. There's 2 different ways, or there's 2 different types of ways to do it, and one would be a 2-step test, which would be to pump up the cuff until you hear the systolic, and then that's how you would indicate how high to go. But I'll be doing the 1-step procedure. Okay, so we'll get started. This might be a little tight once the cuff is inflated, okay? Just letting you know. But let me know if you're uncomfortable at any time. Okay. Alrighty. If you could just rest your arm. So what I'm listening for is the systolic, which is the contracting of the heart over the diastolic, which is when the heart releases. A normal range for someone like Helen would be between 100 to 140 for the systolic and between 60 to 80 for the diastolic. Are you ready? Okay, thanks, Helen. Okay, and Helen's blood pressure was, oh my goodness, it was 120 over 80.
Oh, that's perfect.
Thanks, Helen.
Yeah.
We're finished for today. I'm now going to wash my hands as I just finished the procedure, and I'm leaving the room. Okay, have a good day, Helen.
You too.